This is Sharik from Dr. Amar Sarin Clinic. Today I am going to introduce our patient Raj Patel. 5 months back he did his surgery on tibia with Allen method. We already posted his video on YouTube after surgery. Now he will share his recovery, how was his recovery, and his walking and everything. He will share with you guys.
My name is Raj Patel, and I've already shared my experience after surgery on a previous video, and this time I'm sharing my experience on the frame removal and the post-frame removal. And when it comes to when you're in the frames, for me, I didn't have much pain until the last week. At the last week, my target was 7.5, and right about when I was maybe 6.5, I had a lot of a burning sensation on my leg, and whenever during the physio, it was a little difficult, and I had to take a little bit of painkillers before the physio to take care of my pain. And the last week was a little mentally exhausting. Whenever I see the physiotherapist, I get a little worried because I got lazy to do the physio. It was a little painful, and I was hoping that the days would go a little faster. But before that last week, between like 0 to like 6.5 centimeters, I was completely okay. I was really excited, and right about at 3 centimeters, I was getting happy because I could notice that my legs were getting longer. And after 4 or 5, everyone else started saying that it's really long, and which made me feel more happy. And after I got my 7.5, we went to the X-ray. We went to take an X-ray, and the doctor said, "Oh, I achieved my target." And my frame removal was like 2 days after, no, 1 day after taking the X-ray, and I did my frame removal. Everything went really well, but I thought the physio during the frame time would be the difficult one, but unfortunately, from my experience, the physio after the frame removal is the most difficult. You need to put a lot of work. You need to do physio all the time. It should be like almost 24/7. When you have the frames, you only have to do a couple times. Even the physio with the physiotherapist is okay, but after frame removal, you have to put a lot of work from our side, not just from the physiotherapist side. And the physio itself was a little painful. I didn't take painkillers because I didn't want to use too much painkillers. I don't like using painkillers a lot, especially side effects could be like a little bit of hair falling out. So I didn't like to take it. So the physio was a little difficult than I expected. I think my expectations for the frame was more than the expectations after frame removal. So I didn't expect a lot of pain after frame removal. And a lot of exercises, a lot of hamstring stretches, a lot of tendon Achilles exercises, and we have to constantly do it every day to see results. And I was a little lazy, so my recovery was, even though faster, I could have made it even more faster if I worked a little bit more. And yeah, that was my experience.
So how is your progression with the walking? Like how is your walk now?
So at first, initially, I could only stand up for 1 or 2 minutes in the first day. First day of my standing, I remember I could only stand for 2-3 minutes, and then I asked you if I could sit down. But every other day, I was getting better. I was almost standing as twice as much as just the day before. So the next day, I was standing maybe 10 minutes. The next day, maybe 20. And I think third or fourth day, I was doing very well. I could stand for hours. I guess my muscle was sore for the first couple of days, and later on my muscles were okay. And after 2 weeks, I think I started walking with crutches. I could walk maybe 50 meters? Yeah, 50 meters, 100 meters, not sure. But maybe from there on, I started walking. After 1 week, I was doing really well. I went out with the caretakers, and I was able to walk for. I did 2 laps in the block which was maybe about 1 kilometer. So two lapses would be 2 kilometers. And ever since then, my recovery was pretty fast. There was a lot of muscle stiffness in the morning because of a lot of walking, which I was not used to because I was in the bed for 3 months. So apart from the morning stiffness, I guess my walk really got better. And at the end, I went to Delhi Metro and I was walking. I was walking with the physiotherapist around the area, and I was doing really well.
So, how was your experience, walking experience with the walker, sticks, and without any support?
Okay, okay.
With the walker, it was really easy because all my weight I was putting it on the walker. When I stood up for the first time with the walker, I had a little bit of pain in the gap area where we lengthen, but that went away after like one day. And the transition from the walker to the elbow crutches was more difficult because I didn't know how to use it properly. Every patient, from what I heard from other patients as well, it's really hard to
But once I teach you, you understand
Yes,
how
yes.
to walk on
Right,
the
Right. Once you taught me, it was way easier. And but still, I had to balance and stuff. It took a while for me to understand how to do it. And from there on, I transitioned to just walking without the elbow crutches. I was just using the walls and anything I could grab on at first. And later on, I managed to, I think my muscle memory came back or something. I don't know. I was walking properly, but there was a lot of pressure on the knees. But I didn't have any pain or anything, but a lot of pressure, so I was a little worried, but everything went well.